Hello, todo mundo. Muito bem, sou Múcio Porto, cirurgião plástico aqui em Brasília e Dubai. Aproveitando esse domingo gostoso aqui em Brasília, espero que no resto do mundo. Hoje a gente tem uma live muito legal com uma amiga, a doutora Nadine Hamada. Ela é dermatologista do Cairo e obviamente a gente vai falar em inglês. Nós vamos falar sobre o que são esses tais de bioestimuladores e a gente vai trocar essa experiência durante 30 minutos sobre esse uso de produtos que vão estimular o colágeno em relação aos preenchedores, que já são uma realidade hoje no mercado. Muito bem, doutora Carla Ferreira, doutora Mariana Nadaf, a Maria Torales, Carol Siqueira, Giovanni Rivoli. Muito bem, gente. Olha, vocês aqui no Facebook, aqui no Instagram, no nosso YouTube e também no nosso podcast, que é o Dr. MPcast. Você pode escutar no Spotify quando você estiver malhando ou fazendo alguma coisa. Enfim, então a nossa live hoje é uma live internacional. Isso é legal porque a gente troca experiências e ao som de Egypt, que é uma música linda que eu escolhi em homenagem à doutora Nadine, que mora no Cairo. A gente então vai fazer essa live. Dr. Nadine Hamada, how are you? Be welcome, my friend. Yes, Dr. Nadine, I'm here in Brazil, the sunny Brazil. I hope you are fine. I'm waiting for your invitation for me to accept. Let's talk to you, doctor. Okay. You are here. Hi, Dr. Nadine. Are you there? Very good. I sent you an invitation for you to stay here. Listen, in Egypt, Dr. Felipe Tozaki from Sao Paulo. Hello, my friend. How are you? Good to have you here. Can you listen me?
Yes, I hear you
Well,
very well.
I will remove this wonderful music. I'm so sorry. Yes, okay, 1, 2, 3. You know, this song is called Egypt, and I loved it, but we need to remove. Can you hear me, Dr. Nadine?
Yes, very well.
Nice to have you here, my friend. Yes, we are here with a lot of good friends, Dr. Khaled, Dr. Sareed, Tufa Torki. They are here. We are talking to people around the world around using our Facebook, our Instagram, our YouTube. Of course, it will be on our Instagram and Facebook and YouTube pages. It's good to have you here, my friend. How are you?
I'm fine, thank you. How you're doing?
I'm fine. I would just like to introduce you. For all of you are here, Dr. Nadine is one of the best dermatologists in Egypt and, of course, in the world. She's my very good friend from the American Academy of Aesthetic Medicine, and we have some courses around the world. And yes, Dr. Nadine, this is a good pleasure for me to have you here.
Yes.
And as you know, of course, we'll talk about biostimulators. And I would like you to talk to all of us. What does it mean in your impression? Because the word biostimulator is a very wide thing.
Yeah.
In your mind, your experience, what do you think this is the best definition for biostimulators? Tell me.
It's these biochemical products or ingredients that activate the fibroblasts to synthesize more collagen fibers. So we're looking for reactivation of these fibers, which is getting lazy with age, with pollution, with sun exposure. Wake them up, create more collagen to make the skin look smoother, plumpier, more youthful.
Very nice. And you know, we talk on our courses about new definitions. They are coming on. For example, bio-revitalizer, bio something. Do you really think, is there any difference between among those let's say those names?
Well, there are so many names of the market. However, there are some products which binds water for a while, so you will see good effect that would last for a few weeks and then it's gone. And with repetitive use, you will get some collagen fibers being formed. But there are other products that will stimulate directly collagen formation, so the result will be more dramatic and it will last longer. than just binding the water, giving a glow, and then losing the effect in a few weeks. So I think there is a big difference between the word boosters or bio revitalizers and biostimulators in the way it stimulates collagen, the speed of the collagen stimulation, and the longevity of the result.
Very nice. And you know, sometimes in our offices, when we say that I will use on you, madam, a biostimulator. So the first, generally, not always, but the first question is this the same thing as sometimes they don't use the name filler, but instead of that, they use hyaluronic acid, for example. What do you say? What is the difference between biostimulators and one filler?
I always tell my patients, imagine that there is a table and you do have a defect on the wood of this table. So this defect needs a filler. Nothing can fill this hole rather than a filler. So this is what filler is doing. It replaces the volume loss. The biostimulator is like if you have a cloth on top table and the cloth is wrinkled and has a bad texture. This is the kind of material that will iron this cloth, make it shiny, make it smooth, make it look good. It's like the finish for the skin texture. So I can never use biostimulator to replace a volume defect. However, I use it with the fillers to get maximum stretch, glistening, smooth, glowing, and tight skin. So they cannot replace each other, they complement each other in a way.
Very nice. And of course, you know, we have a lot of friends coming in, and Dr. Mohamed Omar, nice to have you here. A lot of friends, people from New York. Very good. So the next question is names, names. Because of course this marketing is blooming all the time, and companies, they want to share this delicious marketing. And names are everywhere. For example, we have Radiesse, Elance, Sculptra, Ganafil, a lot of them. And
Yes.
particularly, what kind of biostimulator you use?
Well, in our region, we don't have everything, not
Yes,
yet. However,
of course, not even here in Brazil. We don't have.
Yeah, but we do have Radius. I tried that before. It gives really good biostimulation effect. However, you have to have good experience with it in terms of dilution, how you make sure that it's evenly distributed all over the skin, how you inject in a uniform way in the subcutaneous layer in order to avoid any lumps or bumps. But it shows really good results that would last for 12 months and more, so it's good. I also tried, of course, Sculpture is coming strongly in the market, but not in Egypt yet. It's going in more in the Gulf, in Dubai, Saudi Arabia more. I'm still a little bit skeptical about it, looking for the best dilution to start my own experience with it. I use Profilo, Yellow Pro, the hyaluronic acid-based biostimulators, and they also show very good results.
Very nice. What do you think about Sculptra? Because Sculptra, as you know, of course, but just to make it clear for everybody, this is the brand of polylactic acid. This is not, of course, new. It arrived in the market in the world in 1990s. At that time, we used to use it for CrossFit, but we got some complications of, for example, granulomas. And it was a big problem at that time. So it disappeared. So in the beginning of 2000s, it returned as with the name Sculptra. So I think generally in the whole world, and especially here in my region in Brazil, many people, they know what does it mean. Sculptra, this is for collagen formation. The product is polylactic acid. So what do you think about polylactic? Let's forget the names. Let's talk about the product, the drug. So polylactic acid.
Yes.
What do you think about that?
always been a famous biostimulator. So regarding collagen formation, we know it can stimulate collagen formation really well. However, I do have a fear for anything that might give you some side effects, and there were a lot of reports. Now we are changing the dilutions to become more diluted for a safer result. But a more dilution means less collagen stimulation. So it's the balance between getting a good result and safe results. And I always say granuloma formation takes a long time to show. And I'm waiting for a long time enough to make sure that the new dilutions are still safe and they don't show any lumps or bumps or foreign body. When we are sure of this, definitely I will welcome it in my clinic as well.
Very good. And what do you think on your practice? I know you use the best things ever, but when you take a look on your patient and your patient deserves, or you need to use both things, one filler and one biostimulator. Let's make it clear for people who are listening to us. Filler, it will fill out, of course. Depression will augment, for example, the jawline, lips, blah, blah, blah. Generally, it has a hyaluronic acid. But of course, your patient needs both things to fill out some lines and to define the face. Let's talk about face, of course. But you think that she or he also needs to improve collagen formation. So we are talking about filler and biostimulator. In your practice, what is your routine? Which thing you use first?
I always start with the fillers to replace the collagen, to replace, the volume defect. The filler itself will create some biostimulation. Hyaluronic acid, when it stays long, it will improve the collagen formation. So in severe cases, maybe I would use both if they can afford it. In patients post-bariatric surgery, losing a lot of weight, or with excessive photo damage, I might combine both. However, I would start with the fillers first, and then I will finish with the biostimulators.
And how long does it take? How many days or weeks do you wait for the biostimulator?
Biostimulator, there's always a rule that you will not see anything as soon as you inject. So you will see some plumpness from the gel effect or the water effect, and will be gone in a day or two. And then we wait 4 to 6 weeks for the new collagen formation. So I don't
6 weeks,
promise,
you say?
Yes, I don't promise my patients anything before 6 weeks. Profilo or hyaluronic acid base, you might see good results sooner, like in a week or so. You will see the glow of the effect of the hyaluronic acid, like a bit of a glow, but still collagen formation, it will take at least 4 to 6 weeks.
Good. We got a very interesting question here from Mr. Ira Gab. I don't know where are you from, my friend? Could you please make it clear? But he's asking us about the brand new thing called exosomes. Talk something about what does it mean, exosomes?
Exosomes are a small spheres that would signal for the activity of and the function of variable cells in the body. So if we think that like mesotherapy is no longer in the trend and growth factors are becoming more stronger because they are able to signal for the activity of the fibroblasts to generate collagen, for better healing. Exosomes are way faster because they signal many cells, many functions in the same time. So I started to use some exosomes for the hair growth. The results are massive. With the skin, so far, I think it's still close to the growth factors, a bit faster, but still it's very expensive. We're waiting for the competition to bring it a little bit down. However, it's very promising so far. It's still under study, but the results we see is very promising.
Yeah, and this is a very important thing you are talking about. And this is interesting and important for us because, of course, people are coming in, coming out, but it will be on our profile, our pages and Instagram and everything. And this is important for us to make it clear that there's a big pressure of companies on this market of rejuvenation. And many things are still to be, let's say, studied more, isn't it, Doc?
Yes.
And as we said it in the beginning, talking about biostimulator, biorevitalizer, blah, blah, blah. Now we are facing this interesting theory. Oh, I'm Ibrahim from Egypt. Thanks a lot, Dr. Nadim. Maybe he's your friend. Thank you, Doc. Thank you so very much. But yes, exosomes, this is a brand new thing, very important. Many studies are coming in. And but yes, with the practice, we still need, let's say, to wait for exactly what role are for each of those options. Of course, we are doctors, we are working for some years, and we have our impressions about those things. And as you told us, for example, you use filler first, then you improve collagen formation, elastic fibers, and maybe hyaluronic acid with biostimulators. And now we are facing this brand new thing, exosomes. This is fantastic, this is good, but the time will show us exactly which is what, isn't it?
Yes, 100%.
Good. And just one more thing, my friend. What do you think about collagen intake? Because when I talk to my patients, when I want to build our home, our house, I need some bricks. I can't do a wall without a bricks. So if we are talking about biostimulation, for example, it means to produce collagen. Let's focus on this fantastic word. And maybe we need some bricks. So it could be like collagen intake. Tell me what you think about collagen intake.
I sometimes think in the beginning when it first showed, but I mean, why would I need collagen if my diet is containing collagen? However, our daily intake is variable, and now we have a lot of vegetarians and vegans, and then you start to see a lot of essential proteins and collagen that is less than before in their dietary intake. And for this, I think, yes, it's very important, especially for patients on vegan diet or with diets that does not involve enough amino acids and proteins, to take a supplement of collagen, of course, 100%. And usually it also comes with other nutrients that we need for the skin, for the hair, rebuild, and definitely, yes, this is a very important, supplementation is a very important part of our practice.
Very nice. We got another very interesting question here from Dr. Ali Nedzi from Kuwait. She or he is asking us about radius. And do you know what does it mean? Is this another brand, radius? And the question is about the relationship with Sculptra. Do you know this brand, this product, radius?
Yes, radius is calcium hydroxyapatite, and I use it.
Oh yes, I'm so sorry, radiesse. Because it was written radius. No, it is radiesse. Yeah. Go ahead.
I would say for safety. So my feedback from my colleagues who've been using Sculptura, the results for the collagen formation is really good. However, we've just been saying that we're a little bit worried since it was involved with a lot of foreign body granulomas in the past. The new dilutions are way more than before. So now you have 5, 7, and 12, 10 and 12 ml per vial. For me, I think radius is safer when you do a dilution 1 to 3, for example. So this is what I personally do. I'm still waiting because if I don't inject it to my face, I don't inject it to anyone. So I'm still waiting for an assurance about Sculptura. But my colleagues that are injecting, they love Sculptura. With my experience, I'm pro-radius.
Yeah, very good. And you know, here in Brazil, radiesse is the name, and Sculptra, they came in the late 2000s, I think. And yes, many colleagues here and many parts in the world, oh yes, Dr. Alinesi, thank you for a collaboration here. And yes, here in Brazil, people are still thinking about the same question, Radiesse and Sculptra, which is the best? Well, as you told us, I I can't say 100%, but in my practice, my opinion, I still like more polylactic acid than calcium hydroxyapatite. And of course, let's make it clear again. Sculptra, this is polylactic acid. This is just biostimulator. But Radiesse, it's the two heads knife. It means this is a filler, but when you dilute it, it's a biostimulator. And I want to tell you another thing. Here in Brazil, we are used to use a non-absorbable product. This is PMMA, as you know, polymethyl methacrylate. Yeah, of course, there are some things we need to make it clear. For example, some areas like lips or other, let's say, delicate parts, it's not the best option. But yes, for butt augmentation, for example, PMMA is fantastic. And we use a lot here in this area of the world. Because as you know, of course, for fillers on buttocks, we need to use a lot of syringes, and the cost goes so high. That's why more and more we are using PMMA. But when you dilute
and you don't
PMMA,
want to use it too fast as well, right? It lasts
absolutely
longer than
yes.
anything else. Yeah.
Absolutely yes. But here it's important because many Brazilian doctors they will see this live. And it's important to remember that, yes, this is another option using non-absorbable products on this area of the globe. And of course, we dilute it and we use it close to the dermis, especially on areas such as the lower half of the butt. It's very interesting. But yes, my friend, I think the question here in this world on this area is to define what does it mean by stimulator, and for helping some colleagues and to stimulate some discussion is to try to decide what is the best, isn't it? And which protocol, just for us, because we are 24 minutes, this is so exciting, but of course we just have 30 minutes. But what is your protocol? For example, you said us that for a face, you will use the fillers first for lips, whatever, nasolabial fold, molar area, jawline definition, and then you decide to use some biostimulator. You decide, for example, I don't know, Sculptra. And what is the protocol you use?
So for the biostimulator, I do one session, and then to boost it, after 1 month, I can do a second. It depends on the amount of collagen reduction or the status of the skin that we're dealing with. So if you're dealing with a very young person, maybe one session would be enough. However, if you do have a person with a lot of collagen loss, a very bad texture of the skin, then we need to do 2 sessions, sometimes 3. So you can do 2 or 3 successive sessions, and then the results will last according to the nature of the material. If we're talking about Profilo or hyaluronic acid base, it might last for 6 months. Calcium hydroxyapatite 12. I think Sculptra, you are the expert. I think even longer.
Very nice. And we got another question from Dr. Mofeki. Where are you from, Dr. Mofeki? Tell us where are you from? And he's asking us about what is the choice after facelifting for better results. Well, thanks in advance, and thanks for you to your participation here. Well, what is your choice, Dr. Nadine? After a facelift, your patient still needs something for the facial, let's see, you know what the expression I love is face tightening, let's say, using a biostimulator. What you prefer after a facelift? What kind of biostimulator do you use? You said us about Radiesse, about Sculptra, about Profile. What's your opinion?
Hyaluronic acid base, I try to, they get the tightness already from the surgery. So post-surgery, I think we need this filter glow, hydration, rather than the tightening that we use for patients that didn't go through a surgery. So patients who wouldn't go for surgery, I will go for Sculptura, for Radias. Patients who've done the facelift, I will go for hyaluronic acid base, like
Wow, very nice. And you know, it's a very good question because in my practice as a plastic surgeon, it's not uncommon for us to listen very rarely, thanks God, about, wow, this is okay, but this is still missing. Why didn't you give a tighter retraction? I always say, of course, we prepare our patients about all the limits with our practice, but yes, this is not uncommon, and more people are facing social media and internet in general. They are learning about all of those let's say products, let's say, or options, and they will ask us. And I also use hyaluronic acid. One of them, this is Profile, the name. It's a fantastic biostimulator, especially for venous rings, or isn't it, necklines, and but also, of course, Sculptra sometimes. And for us to finish our wonderful conversation, tell me about this particular area, the lines on the neck. What is your choice and your routine?
Well, that's a very difficult area to deal with, especially with ladies who love to go to the beach and they get the sun exposure, and then they start to get this sort of damage on the neck and décolleté area. So for me, it depends on their age and the muscle activity. If I do see a very active platysma muscle bands, I would love to start with the toxins first. Release the muscle strain, release the tension, and then maybe I will consider, of course, going with biostimulators according to the degree of collagen loss I see. You can go from Sculptura, Radias, or you can go with the hyaluronic acid like Profilo or the Allo Pro.
Very good, my dear friend. I'm so thankful for you to accepting my invitation. I hope to see you again in our courses around the globe. And I'm so thank you. I would like to thank you so much for having you here and listening this wonderful music of Egypt. I want to say everybody that our live will be recorded on our both pages on Instagram, Facebook, everything. Thank you, my dear friend. I hope you will see each other again. Thank you so much.
Bye.